Okay? Great. Well, welcome. There are so many people here. You sure there's enough room? Okay. Glad you came today. And I'm glad I can be here. My name's Brent Pace. I am a licensed clinical social worker, and I am here to talk to you today about three really important things: anxiety, depression, and migraines. And why those three things? I'm going to get into that. It may not appear that there is a connection between these three. When we first look at them, maybe at first blush, they don't seem to be related. But I think as we talk about them a little bit, we'll see that there is an interesting connection. And maybe for some there isn't, but as I have gone through the literature and have looked at the variety of different things that are written about depression and anxiety, and then looked at migraine specifically, there is an interesting connection between these three illnesses, and I do call them illnesses, as I'm sure you understand migraines to be. I treat depression and anxiety a lot. Those are the primary illnesses that I treat as a therapist, and they are not to be trifled with, I guess I should say. Depression is an interesting one because I think a lot of times people will say, "Oh, I'm so depressed." And when people say, "I'm so depressed," really what they're saying is, "I'm so sad," or "I'm so frustrated with something," or "I'm feeling down," or "I'm feeling blue." But depression is actually a mental illness that is not simple to treat and can be very difficult to overcome. And we're going to look at a couple of details about that. Anxiety is something that I diagnose quite a bit in my practice. Anxiety, particularly what we call generalized anxiety disorder, is something that a lot of people suffer from. And we're going to look at the diagnostic criteria for that and see what that is specifically. And it will be interesting to get some feedback, hopefully, from you about that. I was hoping that we could make this a little bit of a discussion as we go through, and I definitely encourage questions as I say things, anything that comes up, or things you'd like to add. I am also going to do something that I would hope that you would be interested in participating in, and that is something that I learned at a retreat called that is through the Center for Mind-Body Medicine. Mind-Body Medicine is something that I am very interested in using in treating mental illness, and also for treating migraines, for treating other illnesses like post-traumatic stress disorder and other trauma disorders. And it's something that is really effective in treating all of these. And one of the things that I'm going to introduce today I think will be really helpful, and it's going to probably be something that's going to go a little bit out of your comfort zone, but I think it'll be fun to do. So, what are your thoughts when you see this picture?
Hopelessness.
Hopelessness, yeah. So as we define depression, think about what it means to be severely depressed. And think about, as we look at this, not just yourself, but other people that you may know in your family, or people that you know maybe that have been diagnosed with depression or who are suffering from depression currently. And we'll just go through some of the diagnostic criteria here. One thing, when we look at depression and we are looking for symptoms of depression, are of course feeling sad, feeling tearful, feeling empty, or feeling hopeless. So very often when I'm doing a diagnostic evaluation with somebody, I will ask, are you feeling tearful? Somebody doesn't have to be tearful to be depressed, certainly, but this is one of the diagnostic criterion that we look for. And also, of course, hopelessness, feeling empty, feeling tearful is very common. Next one is having angry outbursts, irritability and frustration. So you might think that somebody is being irritable because they are cantankerous and that's their personality, but maybe you dig a little deeper and find out that they're actually depressed. So that's something to keep in mind. Beyond that, loss of interest in most normal activities. Very often we'll ask if a person has lost activity in things they used to enjoy. So maybe they used to like to walk to the edge of a particular lookout and watch the sunset. Maybe they've had a loss of interest in sexual activity. They've lost interest in hobbies they used to have, lost interest in sports. So anytime there is this kind of a loss of activity or loss of interest in activities, we call that anhedonia. And anhedonia is very often something that you see with major depression. I should clarify that these are diagnostic criteria for major depressive disorder, which is the most serious of the depressive disorders in the DSM. There are others, and we'll talk about those too. And then sleep disturbance. So a person might sleep too much or might have difficulty sleeping. So both of those can be signs of depression. So a person might say, well, I lie in bed and I don't fall asleep until 3 o'clock in the morning, or I just toss and turn, or I fall asleep, but then I wake up early in the morning and I can't fall back asleep. So sometimes that, not in and of itself, but sometimes if that's happening with these others, that can be a symptom of depression. And tiredness or lack of energy, even small tasks are difficult or take extra effort. So if a person's just dragging and they say, you know what, I just have a hard time getting to work, or I have a hard time just filling the dishwasher or cleaning the plates off the table after dinner or making dinner, that's very often also a symptom. And then, of course, we always ask about appetite. Has your appetite changed in the last 6 months? So that can be reduced appetite, or it can be a person who's overeating or eating more than they're used to. Both of those are symptoms. And then, interestingly enough, a symptom of depression can be anxiety. And one of the things that I want to stress is that anxiety and depression are related. So very often a person can have both symptoms of depression and anxiety at the same time. So symptoms of anxiety can be a sign of depression, and so can agitation and restlessness. So, and then this final one, slowed thinking. Sometimes I have people say, you know what, when I think, I just feel like I'm sluggish. I just can't get the words out, and they'll speak slowly, or I'll even notice that as they're filling out the paperwork that I ask them to fill out, that it's much slower than most people would be filling things out. And so that can be a symptom. So, what's important to remember is that you don't need to have all of these symptoms to be diagnosed with major depressive disorder. In fact, in the kind of the Bible of Diagnostic and Statistical Manual of Mental Disorders, you only need to have a certain number of these to be diagnosed with depression. But this is more of an exhaustive list. Okay, so I think this is the last one I have. Feelings of worthlessness, guilt, or fixating on failures or self-blame. This is very common where I have people feeling like they're responsible for things they're not. Feeling guilty about something that's really not an appropriate feeling of guilt, or feeling guilty about something for a long time, something that happened a long time ago, or blaming themselves for something that really isn't their fault. So, any questions about all these?
Does age play a role in that?
So this is an interesting question. When you look at the diagnosis of major depressive disorder, you will see that there is an increase of the diagnosis in ages 55 and up. So it becomes more common in elderly people, of which I belong, by the way. So I have to watch that. But the specifics of who's diagnosed with depression and who isn't is really interesting, because we also see depression in younger people as well. So we certainly do see depression in teenagers, and a lot of times it depends. It's rather complicated, I guess I should say. It really depends on the situation, it depends on the familial background, and it depends on environment. It depends on whether a person is male or female. So women are twice as likely to be diagnosed with depression than men, for example. And the other piece is, what is the treatment for depression? So it's different. It's going to be different in terms of its efficacy for teenagers versus middle-aged people versus elderly people. So all of that gets a little complicated, depending on who's being treated. Other questions about all this? So let's talk a little bit about, oh, there's one more that I haven't, trouble thinking, concentrating, or making decisions or remembering things. This is really important, because when I see clients who are in school, for example, I get really worried about the fact that they're coming in and saying, I'm having really a hard time in school. I've never had a hard time in school before, but I've started to feel really depressed. I'm having all of these symptoms, and I'm doing really poorly in school, and I've never had that problem before. Oh, boy, there's a lot of these. Frequent or recurrent thoughts of death, suicidal thoughts or attempts of suicide or actual suicide. I can't forget this one. Does anybody know, I'm sure you've all heard that Utah is known for something specific to suicide? That we have a very high suicide rate among teenagers in Utah. Have you heard that? And so our concern is, what do you do about a statistic like that? What do you do about a statistic that says your state has a really high suicide rate among this group of people? Who goes and takes care of that problem? How do you take care of that problem? What do you do to address that issue? And one of the things that I'm working on individually, and also with a group that I'm working with, is identifying whether there is a subgroup of teenagers that are higher risk than other subgroups of teenagers. And one subgroup that we've certainly identified as having a higher risk of suicide are LGBTQ plus kids. So gay, lesbian, bisexual, and transgender kids are higher risk of suicide than kids who are not in that category.
How does that break down, LDS and non-LDS?
So those are difficult numbers to gather because of several things. One is that suicide is underreported. So there are kids who commit suicide and we don't know about it. We don't know the cause of death of every child. We do have some suspicion that the predominant religion in Utah, being LDS, has something to do with the suicide rate, but we don't have absolute proof of that. When I talk with young people who are suicidal and who are depressed, many of them are LDS, and they're struggling with their sexuality. And so, from my perspective, I think that does play a role in the suicide rate. But I don't know exactly how much. I can't tell you, this is the percentage. So, there is one thing, however, that I like to do when I talk about suicide, and that is to say that the University of Utah has done some really good things. And one of them is, if you have a smartphone on you and you don't know about this app, then I would ask you to take it out and take a look at your smartphone. And the reason I'm having you do this is because I want as many people to know about this as possible. And just go to your app store, whatever that is. And look up an app called, I don't want to go too fast here. Are we there yet? Okay, so look up an app called SafeUT, S-A-F-E-U-T. Got it? Yeah. Okay. So if you download that app, what it asks you to do is say which university you're affiliated with, and you can say University of Utah. And once you download it, I'm going to show you what it looks like on my phone. Because I think this is one of the most important tools there is for kids who are struggling with suicide. So it looks like this, and then it requires you to put in a passcode, and then it looks like this. And what you can do once you get to this page is you can tap this button and immediately start a texting chat with an LCSW or CSW, some mental health worker, immediately, and it's anonymous. So anybody who's suicidal or thinking that they're very depressed and thinking at all about suicide can do that. Or they can tap right here and connect by phone to a mental health worker and have a conversation with them. The reason I ask you to download it is because I want people to know about it and share it with other people. If you know a young person who is depressed or you're worried about them, or even if you know a young person and they're not depressed or you worry about them, tell them about this because they can share it with their friends. One of the great things about this too is that you can submit a tip to a school. So if you know that there's somebody who is thinking about suicide and you don't know what to do, you can submit a tip and say, hey, there's this kid, I don't know what to do about it, but he was talking about suicide. Because we know if somebody's talking about suicide, the likelihood goes up dramatically that they will attempt. Okay? Great. So, let's see if we can go to the next slide here. So, what do you do if you know somebody who's depressed? What do you say?
Just try to get them to do something fun with you.
Okay. So involve them in something, some activity.
Yeah.
Yeah, okay. What if they say, I'm not interested? Go away. I'm not interested in having fun. Leave me alone.
I asked one more time.
Okay. So what happens, and what I've listened to a lot of people say is, I have friends who want me to go out and look at how beautiful it is outside, and that makes me feel more depressed. Which is kind of interesting, isn't it? So it's kind of counterintuitive. The very thing that you think is going to help somebody who's depressed, like go out and look at the flowers, go out and look at the sun, go out and go on a hike with me, sometimes that makes them feel more depressed, which is really interesting. And so one of the things that I tell people is the very best thing you can do with someone who's depressed is just listen. To just be present and listen. Because what that person has to say, very often people don't want to hear. And they keep bumping into somebody and they want to say, let me tell you about how I'm feeling. And that person goes, I don't really want to hear about what you're feeling, but let's go to Lagoon. They say, I don't want to go to Lagoon. I want to tell you how I'm feeling. Well, I'll talk to you about how you're feeling, but let's go get a shake, or let's go drive downtown and watch a movie. I don't want to watch a movie. I want to tell you how I'm feeling. They may not say that with their words, but very often that's what they want. They want someone to listen to how they feel. They want someone to talk to. And that is one of the most important things we can do. When I say that depression is counterintuitive, I want to say a little bit more about that. Depression actually tells us, if we're depressed, it tells us to do all of the things that will keep us depressed. It tells us to do the things that will keep us exactly where we're at. It says, don't go outside, don't exercise, don't eat well, don't talk to friends, don't be going and doing things that you enjoy, oversleep, overeat. It tells you to do all the things, like something in your brain tells you to do everything that is going to keep you right where you're at. And so it's very challenging as a therapist to work with someone who's that depressed. So when someone comes in and works and says, I want to work with you, Brent, because everyone tells me I'm depressed, and I think I am, and I do an evaluation and I realize, yeah, this person's very depressed. And I know that there is one thing I can tell that person to do that is going to be the most effective for depression than anything else. What do you think that one thing is? There's one activity that can be, that's the most powerful antidepressant. Thank you. Breathing is very, very good, and it involves breathing. It's similar, but it's exercise. Cardiovascular exercise is the most powerful antidepressant we know. If somebody will go exercise for 20 minutes a day and do interval training, meaning they'll go walk really fast for a few minutes and then slow down and walk really fast, and they only have to do it 20 minutes a day, that's the most powerful intervention for depression that we know. But when you're depressed, you don't want to go do that. That's the last thing you want to do. Don't tell me to go exercise, Brent. And so, what do we have to do? If a person is not capable of getting up and going and exercising, and I work with them, and I'm using all of these different techniques. I'm using cognitive behavioral therapy and existential therapy and narrative therapy, and I'm doing all of these different kinds of interventions, and they're still depressed, then what do we do? Very often.
Pill?
Do what?
A pill?
A pill. A pill, yeah. An antidepressant, right? And so that's where we get into looking at using pharmacology to try to help somebody get through that really, really difficult time where they're not able to do anything to help themselves. They're coming to therapy, and that's good. But even then, sometimes they're calling and saying, I can't get out of bed, I can't come to therapy. And then I'm like, oh no, this is getting really bad. I think I need you to go see your doctor and ask about an antidepressant. Because then an antidepressant can help bridge the gap between that moment where they can't do anything to where they can start doing some of the things I'm suggesting, right? But what's the problem with antidepressants?
You get addicted to it?
I don't know of any antidepressants that are addictive. There are anti-anxiety drugs that are addictive, called benzodiazepines. But most antidepressants that I know of are not addictive. So things like Prozac, Paxil, Lexapro, all those medications are not really addictive. You can develop a dependence on them in the sense that when you go off them, you have to be careful and you have to go off them slowly. But they're not addictive in the sense that you abuse them. So in that way, they're safe for that. They are powerful drugs, but they're safe in terms of addiction. But what's the problem with antidepressants? Has anybody known somebody on an antidepressant? No?
Does it change the way they are?
So some people say this changes the way I feel or it makes me numb. So that's one of the challenges. Yeah. One of the biggest challenges that I have with antidepressants is they take so long to work. So they say, well, I started on this medication, but the doctor says it's going to take 6 weeks to know if it works or not. That's a long time for someone who's depressed, right? The second problem is if you're a teenager and you start on one of these drugs, there's a black box warning, meaning that it increases the risk of suicide. So here's a drug that's supposed to treat depression, and it actually increases initially the risk of suicide in some adolescents. And so we have to be really careful during that first period of time when they start taking it. Because what happens is the energy can go up, and they might act on their depression because their mood isn't going up as fast as their energy is. So that's a concern. Other concerns are that there are side effects, right? So there can be negative side effects to these medications sometimes. But if a person is struggling that much, what the research shows is that medication and therapy together is the most effective way to treat major depressive disorder in most people. So I have seen it work wonders with some of my clients. And so I am not here to say to not try that. I'm here to say it has worked wonders with many of my clients. So it's definitely worth trying. Okay. Does anybody know what kind of flower this is? It's called a daylily because they come out during the day and they open up, and then at night they close, kind of like that. This was in my front yard about 6 weeks ago. About 6 years ago, a woman that I know who lives in Paris, France, and who I've known for 35 years, was visiting me here in Utah, and she said, I want to give you something special for your birthday. And I said, okay, that's really nice. And she went to Costco and she bought me a DSLR camera. And I was like, wow, now that's a gift, right? And ever since then, I've had this hobby of trying to learn how to use this complicated machine, because they're complicated these days, right? They have so many buttons and bells and whistles, I mean, I've worked really hard to try to figure this thing out, and I still am learning about new things about it. But what I encourage clients who are depressed or who have trauma or who are anxious is to find a hobby that can engross them, that can give them something to do. This has been one of the best things that I've ever done, is to pick up that camera and go out and find things to take pictures of. All kinds of things, even things flying. I took this picture. This is a neighbor in our in my neighborhood, and I put this picture up because I wanted to remember that LGBT clients are at risk of suicide. I didn't want to forget to say that. These are 3 of my sisters. This represents 1/3 of my sisters, more or less, because I have 10 sisters. So not quite 1/3, right? If you have a family member who's depressed, then you have a likelihood that you might be depressed, right? So there have been varying research studies over the last several years. Some of them have said, no, there's no indication that family conditions will increase your chances. But then a really interesting study came out this year that said, no, there really is an indicator in the genes that increases your chance of having depression if one of your family members has depression. So it's definitely something to pay attention to. One of the things that has helped me and has helped some of my clients is giving them something to do, and one of them is writing poetry. This is a woman I knew back in Massachusetts when I lived there, and it's one of my favorite poems. She went through a very, very dark period of time when her brother died of AIDS, and she's become a very, very well-known poet. Sometimes the moon sat in the well at night. Sometimes the moon sat in the well at night, and when I stirred it with a stick, it broke. If I kept stirring, it swirled like white water, as if water were light, and the stick a wand that made the light follow, then slow into water again, unwobbling, until the wind moved it. And I thought of all the moons floating in the wells and rivers, spilling over rocks where the water broke, moons in the sheep water, the chicken water, or here or there an oar bent it, or a woman spread out her skirt and let it pool there. The light, I mean, not the moon in a circle, not the moon itself, but the light that fell from it. Now when she writes, I just get peace from her poetry. So I read that sometimes, and I think she found some peace through her work. So I wanted to talk about generalized anxiety now. But before I do, I want to ask, why do you think, when I was asked to do this presentation, did Dr. Degree ask me to talk about depression and anxiety and migraines? What about that description of depression is related to migraines? Anything? Being anxious about triggering a migraine, absolutely. Sitting on pins and needles, wondering if you're going to do something and then you're going to have a migraine? Mm-hmm. Absolutely. Yes?
I was just going to say, this is a personal private therapy session tonight.
Sure.
But you can see anxiety as you just said, you could also be depressed about the effects of migraine headache.
Absolutely. Absolutely. And since it's a private therapy session and I'm part of it, I can tell you I get migraines too. And there's something about a migraine. I had one yesterday, and I had to go to work, and I had to be there, and I had to be strong, I had to be on top of it, right? And that's hard. It's hard. Because there's a part of me that just wants to go to bed and just pull the covers over my head and not be a part of the world. Have you ever felt that way? It's the way it feels. At least that's the way it felt for me yesterday. And so when I have one of those months where I have that migraine, I don't know if any of you can relate to this, but you have that migraine and you can take a rescue medication and it goes away, but then the next morning it's back. And then you take a rescue medication and it's back the next morning, and then you take a rescue medication and it's back the next morning. That's discouraging. And I think over time, any chronic illness can lead to experiencing feelings of depression. So I think there is really a link there. Many people with chronic illnesses can experience symptoms of depression because of that, just that grinding realization that, oh, I don't know, I can make a plan for this weekend, but I don't know if I'm going to be able to do it for sure, because I could wake up that morning and have one of those horrible migraines that feels like a jackhammer on the back of my head, right? Okay. Any other observations about that?
So how you manage that, like if you had the migraine?
How do I manage it? There are a couple things. Gratefully for me, triptans work pretty well. They take a minute, but they work.
Over the counter or prescription medication?
It's a prescription. The other way I handle it is I grit my teeth a little bit until they work. And then I, you know, very often I'll forget certain things that I'm supposed to be doing, like I'm supposed to be hydrating better. And I'll think, oh, I should have hydrated better yesterday. Or I didn't get enough sleep last night. Or I'm not paying attention to what I'm eating as well as I should, or whatever. So it's a good reminder. So I think anxiety is actually going to be one of those things that is more clearly linked to migraines. So one of the things I look for when I diagnose anxiety is restlessness. So just not being able to sit still. Another one is this feeling tired easily. Next one is difficulty concentrating, very similar to depression. Just, you know, I can't concentrate at school, I can't concentrate on my work. Irritability. Do you ever feel irritable when you have a headache? I know I do, definitely. And then muscle tension. So I think anxiety and migraines are very similar in this way. And then problems with sleep. Anxiety is one of those disorders that a lot of people say, I can't turn my mind off, I can't turn my brain off when I lie down. I just have that thing that just keeps coming back into my head over and over again. And it just keeps coming and I just can't stop it. It drives me crazy. So anyway, I think with those, definitely. And then there's one more that I forgot to put up there, interestingly enough, which is headaches. Headaches are very common with anxiety. So I want to do something with you right now that is something I learned at that Center for Mind Body Medicine that I told you about. And hopefully you'd be willing to do this exercise with me. And I'm actually going to sit down myself to do this, because you have to be sitting. And if you put everything away that's going to get in your way. Just put it to the side. And this is called a soft belly breath. And I've found this to be one of the most helpful things I've ever learned for anxiety, for depression, for trauma, for migraines, for just about anything. And I'm going to explain why it works scientifically after we do it. So, if you'll have your feet flat on the floor and your spine straight and then relaxed as much as you can. And you don't have to close your eyes, but do so if you feel comfortable. If not, just soften your gaze and look towards the ground. And just become aware of your breath. And breathe in your nose and out your mouth. In your nose and out your mouth. And as you do this, I want you to make this a diaphragmatic breath. And what that means is you breathe with your belly. Your belly expands as you breathe in and goes in as you breathe out. Expands as you breathe in and goes in as you breathe out. And just say in your mind 2 simple words as you do this. This as you breathe in, moment as you breathe out. This moment. This moment. Now, if you're like me and most people, as you do this breath, thoughts are going to come into your mind that are going to distract you from focusing on the breath. And what I need you to do is just look at those thoughts and say, thoughts, 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 and come back to focusing on the breath. How it feels going in your nose, and how it feels coming out your mouth. This moment. This moment. And if you're like most of us, you might have worries come into your mind, worries about things you have to do tomorrow or tonight. Just name those worries, 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 and breathe, focused on the breath. And keep that focus on the breath. Now take 3 more breaths like this. Okay. What did you notice?
I relaxed.
You felt relaxed? Good. Anything else?
Like this is the most oxygen I've had in a while.
It's the most oxygen you had, was it?
Yeah.
Good, okay, good. Excellent. Anything else?
It was hard to concentrate for me.
It was hard to concentrate, thank you. It is really hard to keep your focus on that breath, isn't it? It's really hard. And that's okay. That's what's supposed to happen. You're supposed to have your concentration get distracted. But the key to this is bringing it back to the breath. And then bringing it back to the breath. And then getting distracted and bringing it back to the breath. And you're getting distracted and bringing it back to the breath. Because what you're doing is you are like building up a muscle of concentration. So, like if you didn't get distracted at all, I'd be like, you are my Zen master, right? Because we all get distracted. That's what happens. That's what our brain does. It goes, hey, you can't do this. You're supposed to be paying attention to something else. There's something else going on. And you go, no, just give me this minute, okay? So, I have to tell you, so I went to this training, and it was for 6 days, and we did this breath a ton. Like we did it probably like 30 times a day. And I had been told to go to this training by the medical director where I worked. And where I was working was a program that provided mental health treatment to survivors of torture. So these were refugees and asylum seekers who had typically been tortured by their government. And they had come to Utah and they sought out treatment. And part of my job was to hear their story and document it so that we knew that they had actually met criteria for treatment. And as you might imagine, sometimes that would get kind of upsetting. So I came back from the training and I went into a session with this gentleman who was from a particular country, and he told me his story, and it was very upsetting. And as was usual, after it was over, I documented it all, and I went out to get a drink of water, and I noticed that I was breathing like that, just automatically. I didn't realize I was doing it, but I had been so trained to do it that I was breathing diaphragmatically, and I was so calm. And what I had done before, when I'd had these intakes, was that I would get really upset, and my breathing was like this. Right? But because I had trained myself, the minute I had that traumatic event of listening to this story, I went into this relaxed mode. So, why does this work? We all have a central nervous system that's broken into two parts. One is the sympathetic nervous system, and the other part is the parasympathetic nervous system. The sympathetic nervous system is what keeps us safe. Sympathetic nervous system is the fight or flight response. So if something dangerous happens to us, that's the part that says, you got to get out of here, or you've got to fight this person. And what happens when we're faced with danger, real danger, is we immediately have something happen automatically that we don't have any control over, right? We don't have any control over this. It's autonomic. And what happens is adrenaline gets dumped into our body, right? And our heart starts to race. And blood goes away from our fingers and our toes, and it goes to the big muscles so that we can really fight if we need to, or run. You've heard of people like being able to lift a car when they're under a lot of stress, when they see somebody who's been hurt and they can just like have this superhuman strength. Well, that's what's going on. They're in fight or flight. Their eyes dilate so they can see the predator. And all of this happens without any thought at all. It just happens. And what's really interesting is that we share this with mammals. So if you've ever watched a nature show and you've seen a tiger chasing a mammal, right? And the mammal's running like crazy to get away. And the tiger's chasing 3 or 4 of them. And one of them gets away. And if you ever see the cameraman pan over to that one, the one that got away, 5 minutes later, it's just eating and drinking like nothing happened. right? What has happened is they've gone into fight or flight, they've run like crazy, and then something has happened. The parasympathetic nervous system, which is the second half of their nervous system, has come in and said, everything's okay, you can relax. And it goes, oh, cool. And it relaxes. Now the problem is, human beings have the parasympathetic nervous system, but we don't listen to it. Because our big brains, which they don't have, our big brains are going, okay, I got away, that was great, but what if it happens again, right? Like we get in a terrible car accident, and we survive, and what do? We tell everybody about it, right? You can't believe what happened. I was driving down 4th South, and I was just minding my own business, and I was going through this green light, and bam, this guy T-bones me. And my car goes spinning around, and like things were flying all over the place, and it freaked me out. And then the next day you get up and you get in your car, and you're like, oh my gosh, I don't think I can drive. Maybe I won't drive today. Maybe I'll have my husband drive me, because this is really freaking me out, right? And you remember it, and you remember it, and you remember it.
Is this PTSD?
Well, it can be PTSD if it's bad enough, right? So when I work with a vet who's been on 4 tours to Afghanistan or Iraq, that's what's happened, is that it's become so set in stone that I have a client who drives down the street, and if he sees a box on the side of the road, he spins his car around and goes driving the other direction because he thinks it's an IED, right? So that's PTSD. Yeah, absolutely. And when he hears fireworks, he goes into that mode immediately. That he can't control. But what he can control is by breathing, he can activate that parasympathetic nervous system to help slow it down. So this is fight or flight, and this one is rest and digest. That's what he needs, is the rest and digest. Now, why does it happen? It happens because when you breathe like that, you're activating the vagus nerve. And the vagus nerve comes out, it's the 10th cranial nerve, and it comes out and it goes down, and it goes down through your belly. So when you breathe, you're telling that nerve that everything's okay. And the more you concentrate on your breath, the more it knows you're safe. You're safe and sound. And that's why you feel relaxed when you do it. That's why you feel oxygenated when you do it, because you're breathing the right way, by the way. This is not the way to breathe. That doesn't give you oxygen. This does.
When I get migraine, one friend told me I should take deep breaths because I need oxygen, she told me.
Yeah,
Makes sense.
it's true. It's true. Learning to breathe is one of the hardest things we do because we've taught ourselves how to breathe differently. So learning to breathe is really powerful. So a couple things happened before I came here. Number one, my MacBook went on the blitz because I downloaded the new Mac OS, and I shouldn't have. So I don't have a handout for you. But I do have a handout that I can email you. So I'm going to give you my email address, which will allow you to email me and I can email it, or I can email it to one person and they can email it to you. Second thing is, I have a breathing page, a page that has these breathing exercises on it. And all you have to do is click on it, and you can listen to these exercises and you can do them on your own. Okay? There's the breathing that we did, a 5-minute one, a 15-minute one, and then there's a meditation called Loving Kindness, which I think is really great. Hi, welcome. Okay, so here's what I'm going to encourage you to do. If you were to do this breath 5 minutes, not an hour, this is not a breath you do for an hour, 5 minutes in the morning and 5 minutes at night, I promise you, you will feel better within a week. Now that's a big promise, I know. But I promise you, you'll start feeling better in a week. What I mean by feeling better is you will feel more relaxed, you'll feel more calm, And when you get into situations where you get anxious, you will be less anxious. You'll have less of a reaction. You'll be able to respond better. Okay? What do you think?
Question for you.
Please.
The word yoga has come up in discussion. Is that a related activity?
It's very similar, yes. So when you do yoga, you learn to breathe. And yoga, actually, I would encourage absolutely as well, because yoga adds movement to the breath, and movement with breath is very powerful. If I had time, I would show you some really simple yoga movements that would help with that. But this. Oh, you're doing yoga right after this. You're doing it? Fantastic.
Question. If you have a lot of anxiety, can you stop and like do this exercise?
Yes, absolutely. Absolutely. Yeah. Okay. Do I end right now? Okay. So I am going to go quickly through a couple of these slides. I know there's a way to do this, but since it's my iPad. Okay. So this is my email address, brentpacelcsw@gmail.com, or that's my direct phone number. You can call me as well if you'd like. And if you give me your email address, though, I can send you that page I told you about and answer any questions that you haven't been able to ask, okay? So I hope this has been helpful. I really appreciate your coming and your questions and your attention. Thank you so much.
Thank you.
You bet.